manager and administrator.
We'll be talking about many aspects of the career and answer any questions.
I am a Bellarmine University nursing student, and I will be asking a professional in the field.
I am a nurse administrator at Baptist Health in the Mother Baby Unit.
What is the current population status for nurses on a national and state level who are managers and administrators?
Well, let's see here. If I can remember correctly, it's 352,200 nationally and 4,710 between 8,100 in Kentucky.
What is the population that you usually serve in the setting in which managers can typically work?
So since I'm a nurse administrator at Mother Baby, my population is mothers and their children. And you only find that in a hospital, but I could work in doctor's offices and nursing homes as well.
What's the education requirement?
So education requirements vary drastically because you can have a bachelor's degree and get a nurse administrator job, but some bigger corporations are going to want you to have your master's or be in a master's level program. And then you can also get 2 certifications with after you've at least done your bachelor's. And I might add that if you do get a nurse administrator job with a bachelor's, you have to have some experience with bedside nursing. So those credentials would be through the American Nurses Credential Center and the Association of Critical Care Nurses. And those are exams, and then if you pass, you get certification. And the certification normally lasts up to 5 years.
What are your roles and responsibilities?
So I have many responsibilities, as you can tell with my big fancy office here. One of them is hiring new employees. I supervise the unit's budget, so I'm like that person who would make a difference between like the glove count we get or like supplies and stuff. I also make the schedule for my employees, so that's also a very important job because you have to make sure the floor is staffed at all times. I also give evaluations, so those 90-day evaluations and then like yearly if you've been working for me for a long time. And essentially we just act as a boss. I also deal with disciplinary action, so if you're bad, I'm gonna write you up, fire you, take away your license maybe. Just kidding, I don't have the authority to do that. And then I also act as the intercessor between administration and staff since there are higher ups than me. And then you have to have so many skills to be a nurse administrator because you're not just providing care, you're doing care of staff and care of your patients. And so you need leadership, you need organization, you need to be an active listener because if your employees are complaining to you about something, only you have the power to change that, so you have to see where they're coming from. You have to be a problem solver because that's your job, because if a strategy or a policy isn't working on the unit, you're going to be the one to change that. You need to think of something new that's going to replace that old strategy. You also have to be flexible, and you also just have to be an expert in a clinical setting because questions are going to be coming to you, and you're expected to have the answers.
What is your role as a leader in management?
Leadership is a key quality to being successful in your career. Employees look to you for guidance and help, so you have to be their leader or else the whole unit will fall apart. And one way that I've done this, implemented being a leader, is that I implemented a new strategy that all nurses carry pagers on them at all times to answer call outs more effectively.
Wow, that's awesome. Are there any policies that you guys have to follow as nurse managers?
In fact, there are nurse policies that we have to follow. We have to keep up with competencies and renew them, and they include things such as communication, leadership skills, business skills, and professionalism.
So, because you're a nurse manager and you aren't directly working with patient care, how do you remain a patient's advocate?
I understand your concern there, and all nurses play as an advocate no matter what their role is, and because the patients have to be heard, they're the only reason I have a job and the reason that all the nurses are here. So for individuals, they just need to be heard and respected, and if my nurses on the floor can't answer their questions, I answer their questions. And an example of like what I've done before is a patient was complaining about their medication, and my nurses were like, okay, well, there's nothing we can do about it, blah, 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 and they came to me with their concern. So then I spoke to the patient's doctor on their behalf because nothing was getting resolved and the patient was getting more agitated, and they have a right to have a say in like what medication they are prescribed. And so you're never going to stop advocating for your patients.
Are there any specialty organizations that management can get involved in?
So we do have 2 organizations that we can be a part of. One is the American Organization of Nurse Executives and American College of Healthcare Executives. And both of these help to provide research and ongoing information about the field. They provide vision and actions for nursing leadership. They can influence legislation and public policy to actually get things changed. And they also, they're also their support system also, which is very important as a nurse executive or a nurse manager.
Thank thank you so much for meeting with me. I was really contemplating if nurse management was a career for me, and now I know that it is. I mean, imagine all the time and dedication that you have to put into just doing the best you can, making sure your patients are getting the best and utmost care that they have. And it's because you lead and organize effectively that patients are able to have the most effective patient care and leave with better health than they started with.
I'm so thankful I've given you all of this knowledge, and I wish you luck on your future.
Thank you.